Hello, everyone. Welcome to Connecting the Dots with Dr. Ashaye. It's a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. So today I'm going to be talking about a simple but powerful way to improve your health very quickly. It's something that can work for almost anyone, whether you have health conditions or whether or not you're healthy. It can help people that have prediabetes, diabetes, heart disease, high cholesterol, depression, anxiety, or even cancer, okay? And even if you're already healthy, you don't have any of these conditions, and you just want to stay healthy or improve your health, you want to have more energy, you want to focus better, you want to prevent things like dementia, heart disease, this will work for you too. It's cheap, it's extremely effective, and it has so many benefits. So if you haven't guessed yet, I'm talking about regular, consistent physical activity. So hang on, I know some people might be like, it's too hard, or others might say, I'm already physically active. Well, for those that are already physically active, congratulations. It's one of the best things you can do for your health. And you're going to learn about why and how you can keep going. And if you're not yet consistent being physically active, don't be discouraged. The good news is that you can be starting today. And this is the perfect place to learn how and why it's so important to be physically active. You can learn to start and you can learn how to continue, because I know a lot of people start. The problem is, continuing being physically active. Okay, so before we get into it, you are listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care. It's a membership-based clinic in Sugar Land, Texas, and I am so excited that you're here. If you're seeking a more convenient and proactive approach to your care, come join us. You can enroll at www.intouchprimarycare.com. Remember, you can always listen to this episode and all our episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe. So if you want me to continue with this educational series, please subscribe, please share. Someone might need it. If it's helping, please let us know so that we are encouraged to keep going. So I would love to hear back from you. All right, so let's talk about our topic today. Why is being physically active one of the best things you can do for your health? So scientific studies have shown that people that get 150 minutes of moderate to vigorous exercise per week, that's 30 minutes, 5 times a week, reduce their risk of dying from any condition by 20 to 25%. So that's huge. Just being physically active reduces your risk of death. So by being physically active, if that doesn't encourage you, if you're having difficulty being encouraged to be physically active, with every step you take, you can be encouraged that you are increasing your risk of your chances of survival. So that could be encouraging. So there are different ways to determine if what you're doing is moderate or vigorous exercise, right? So you can use your maximal heart rate, a percentage of that. You can use your respiratory rate, but one easy way to tell is using what we call the talk test. So if you can talk, but you can't sing, then you know that you're doing moderate exercise. If you cannot talk or sing while you're performing the activity, then you know you're doing vigorous physical activity. So that's a very easy way to determine whether or not the activity that you're doing counts as moderate or vigorous, okay? So 150 minutes, 30 minutes, 5 times a week, or you can do 45 minutes, 3 times a week. But even for people that are not able to get that much, let's say you're only able to do 30 minutes, 3 times a week, or even 15 minutes, 6 times a week, that's half of what's, well, not quite half, a little less than what's recommended, you still reduce your risk of death by 14%. So, and even if you can't get to 90 minutes, just by going from 0 to 5 minutes, you reduce your risk, you get some benefit. So being physically active, even a little bit, is better than nothing. So it's okay to start slow. It's okay to start wherever you are. Just get some activity in. It makes a big difference. So what about if, you know, some people are physically active just, you know, because they're trying to lose weight. And while that can be helpful for weight loss, a lot of weight loss tends to be more dietary driven than just physical activity. So, but even if you don't lose any weight, say you're physically active and you don't lose any weight, it is still beneficial. You still get the benefit. So don't be discouraged if you've been physically active and you feel like you're not losing as much weight. You're still getting health benefits from being physically active. So don't stop. That's not a good reason to stop. And when you incorporate dietary changes to that, you will lose weight and you get additional health benefit there. So don't be discouraged being physically active, and, you know, even if you're not losing weight, because physical activity is not the quickest way to lose weight. So, you know, you would need to make some dietary changes, but it is still very beneficial. In fact, if you are physically active and you're overweight, and you compare to someone else that is not physically active, and they're not their ideal body weight, or they're considered normal weight, you may be healthier. So studies are showing that you may even, your risk of death might actually be lower than someone who is normal weight that is not physically active, depending on, you know, how physically active you are compared to somebody that is completely sedentary. So being physically active has enormous benefits. Being consistently physically active, that is. So I had a patient who had prediabetes, for example, and they decided to start walking consistently. So they were doing 30 minutes most days a week. And in about 9 months, their A1C went from 6.4, which was very borderline diabetes. Diabetes is 6.5 and up, went from 6.4 to 6.2. So they hadn't done any of the dietary changes or anything. All that they did was walk, you know, most days a week. And that was the only change they made. And that started to bring their A1C down. So it really can be powerful. It does take some time. If they had added the dietary components, it would have gone down even more. But even by just being physically active, that made a huge difference. Okay. So several studies have shown that people with many different conditions can benefit from regular physical activity. People that are physically active have a lower risk of developing heart disease, dementia, diabetes, cancers, and many other health conditions than those that are not physically active. And those that already have these conditions improve their conditions by being consistently physically active. So, for example, studies have shown that people that have diabetes who are on insulin can actually increase the sensitivity to insulin, increase their sensitivity to insulin, so that they don't need as much insulin when they're consistently physically active. So by being consistently physically active, they reduce how much insulin that they need. Other studies have shown that people with cancer can increase their chances of survival. For example, with breast and colon cancers, studies have shown increased survival by as much as 20 to 30%, and reduction in recurrence with regular physical activity. So that's really powerful, that you can have cancer, and by being physically active consistently, you can decrease your risk of death and also increase your risk of or decrease your risk of it coming back, which is recurrence. Okay, so another study showed that 16 weeks of aerobic exercise training for people with depression was as effective as taking Zoloft, which is an antidepressant, with far less chance of relapse depression. So even with mental health conditions, being physically active can be effective. So physical activity, especially in the cases of mild depression, can be very, very powerful. So it's really important, obviously, that if you are taking medication for depression or anxiety, please do not stop your medication. Talk to your doctor. Don't do this by yourself. But physical activity, you can start physical activity, and with the help of your doctor, determine what else you need. Okay. So there's so much evidence out there about how physical activity helps to treat and prevent health conditions, and in some cases, even better than medications, or just as well as medications. All right, so now you're saying, okay, I want to start. I've always wanted to start, but I'm going to start today. Okay, so what do I need to do? Great, I'm glad you asked. So the first thing is start today, not tomorrow. Okay, so you can start now. You can put on your headphones, start walking around the house. Don't wait for the perfect shoes, the perfect t-shirt. Don't wait for the perfect equipment. Stop looking at that treadmill in your house or bike in your house. Get on it, do 5 minutes. Just start right away. That is the key. Start right away. If you wait, the chances that you're going to do it get lower and lower and lower. And the thing about it, as I mentioned earlier, is it doesn't have to be a whole production. It can be something very simple, just for a few minutes every day. And over time, you can increase how much you do. So when I started physical activity, I walk most mornings. And when I started at 10 minutes. I just did 10 minutes every day. And after a while, I went up to 15 and then 20 and then 30. So you can go up over time. So once you get into the habit of it, it's much easier to go up. So very important, don't worry so much about getting the gym membership and spending an hour in the gym right away. If you go from 0 to that, the chances that you're going to keep doing it consistently are so much lower. So number one, just start today. Number two, try to pick something that you enjoy and that you can fit easily in your schedule. So if you don't like walking, don't make that the activity that you're going to do. Choose something else. Choose swimming, choose stretching, choose, a dance class online. There's so many online resources for physical activity now. Choose yoga online, choose something else. So very important, choose something that you enjoy, but also make sure it fits into your schedule. So if you're willing to wake up 15 minutes earlier, you can do that. If you're not, then maybe you do it during lunchtime, but make sure it fits in your schedule in a time that you would be able to do it consistently. And then the third thing, there are a lot of things, but third thing that I will share today is have a relapse prevention plan. What do I mean? So anytime you start something new, it takes time to get used to it. And if you don't plan ahead of time, it's a lot harder. So for example, when you start and you have a schedule, some of the things that make it easier is if you know you decided to do it in the morning, have your workout clothes out, the night before, have your tennis shoes, put everything in the same place so that it's easy for you to just put everything on, go for your walk and come back. Don't make it as easy as possible. Set yourself up for success. And then if you know that things are coming up, Christmas is coming up, you're going to have friends and family around, you may want to sleep in more, then maybe you want to have an alternative, or maybe when it rains, you want to have an alternative. You can't walk outside. Now you go on your treadmill instead, or you walk inside. You need to have a plan ahead of time. Don't wait until it's time for the activity to make a plan, because then you're not going to do it. So if you have a plan for when family comes over, we're all going to go outside and do this activity. We're all going to go for a walk. We're going to go to the mall and walk around, whatever it is, make it plan ahead of time so that you're less likely to not do it. You're more likely to actually follow through. Okay, so I hope that helps. 3 things: start today, start right away. Try to pick something, excuse me, I guess. Try to pick something that you can try to pick something that fits easily in your schedule. So that's important. And then make sure that you have a relapse prevention plan. Very important. Okay, so if you haven't picked anything already, or if you're not already doing the activity, please decide to do it. Do it now. I recommend starting with 10 minutes, just 10 minutes, even 5 minutes, just start. That's most important. It's better to do it every day initially to get into the habit, but even if you can do 3 times a week or 1 time a week, just start. But what I'll say, it's much better to do a shorter period of time if you're just starting out. For example, 10 minutes, 3 times a week, than trying to do an hour once a month. Okay, so you'll be more likely successful when you do 3 times a week. Okay, so now imagine how you must feel. You're sleeping better. When you sit down to do a task, you're able to focus, your mood is better, you're not easily frustrated. You can maybe reduce the dose of the medication or even stop it with help of your doctor, of course. Imagine that you can be that person who is energetic all the time, good mood. There's so many advantages. You can prevent serious health conditions. You can make serious health conditions better. So it's worth starting a physical activity program today. All right, so I hope this helped. So let me know, share in the comments. You never know, it might help somebody. If you are in the Houston area and you are looking for a doctor that is proactive about your care, check us out at In Touch Primary Care. We do things differently here. We help motivated people prevent, reverse, and treat health conditions with lifestyle changes. In addition, our practice is set up so our visits are not rushed. You can reach us easily, and you don't have to delay your care. And since we're membership-based, we can see you whether or not you have health insurance. So you can find out more about us on our website, www.intouchprimarycare.com. Remember, your health is too important to rush. It's too important to ignore. You need your health to enjoy doing what you love. So prioritize your health today. And if you know anyone that might need this, please share this episode with them. Thank you for watching, and see you next week, Wednesday at 2:15 p.m. Take care.